I'm trying to drink a lot of water because I have stitches. I got sewn after I gave birth because I did tear. So they're healing fine though, because compared to my last pregnancy, which I'm going to be doing a lot, I'm going to be comparing and contrasting. Compared to my last pregnancy, I literally could not even like go to the restroom without it burning or without it stinging or like stuff like that. I think it's because I don't know, maybe it was a larger tear. I don't know. But this time around, it's so much better. It's so much easier. Both the pushing out part and the postpartum. So I just realized, I'm like, I don't know what to talk about. Like, I don't know what to do. I've been staying at home for like the past week or so. But I realized like I have not like explained to you guys how my birthing experience went, or like how I knew that I was going to go into labor and stuff like that. Okay, so pretty much I woke up at like 4 in the morning and I was getting like very light cramps, but throughout my pregnancy it had only been like for a couple minutes. Like, it wasn't like for that long, and they weren't like as intense, and they weren't more than like 1 or 2 in a day, right? So I ended up like going to sleep with Adeline that night. She has her own crib. She was sleeping in her crib, and then I think she might have woken me up to like feed her, and so we woke up, and that's when I started feeling the cramps. I got like a couple of them, and I was like, maybe it's gonna go away. And then I started feeling uncomfortable, like I had to use the restroom. So then I went to go use the restroom, and then I came back to the room, tried to go to sleep again. I still felt the cramps, and like, again, I was like, maybe they'll just go away. Maybe if I just fall asleep, they'll go away. I ended up still feeling uncomfortable, so I ended up going to the restroom again a second time. And that second time, I realized I had like light bleeding. And in my last pregnancy, I bled, and surprisingly, like, it wasn't like I didn't have a miscarriage, like, very surprisingly, because I literally bled like I was bleeding from like a big wound or something. It was just so crazy that everything turned out fine with Adeline. Anyway, so I saw like bleeding, and I was like, okay, this is not normal. I should go to the doctor, or to the hospital. So then, I woke up my mom, and I told her I was bleeding. She's like, okay, just go to the hospital. Your brother can take you. So then we woke up my older brother, and he started getting ready. And meanwhile, I was getting my stuff ready. Uh-oh. Okay. So meanwhile, I was getting my stuff ready. I started getting like really bad anxiety. I started like shaking and like not being able to like, like feel comfortable going to the hospital. I literally got chills. Like, I could not stop shaking. And I don't know, I was just like, I need to leave in my head. And we ended up leaving. I was still like shaking in the car. Maybe it was because it was a little cold too. So then I arrived to the hospital, and they're like, is it just you? I was like, yeah, it's me. And then some guy was like, you're so tiny, like, when I went in. And then some other lady was like, your shoe is so small. And I was like, what the heck? They were like, I don't know, it was like a common theme. And then They checked me. They checked to see how dilated I was, and I was 4 centimeters dilated. They're like, yeah, you're gonna stay at the hospital. You're gonna have the baby today. And I was like, okay. So then, obviously the pain started getting like stronger and stronger. I came in at 4 o'clock, right? So then around 6, because they were like, are you gonna get medication? I was like, no, not yet. They came in again, are you gonna get medication? No, not yet. She's like, okay, but you don't want to wait too long. The nurse is like, okay, but you don't want to wait too long because if you do, there might be a point where we won't be able to give you the medication because it could put the baby to sleep, or it could affect the baby somehow. Hello? So I was like, oh, okay. So then I just waited till I was just like too frustrated with the pains, and I was like, okay, just give me the medication. So then I screenshot on my phone because the last time that I took this drug, it literally, knocked me out. It had me doing like some insane things, like literally punching my own stomach. And at the time, like, when I was doing that with Adeline, like, nobody stopped me. Like, I just remember doing it, but, like, nobody was there to stop me. So anyway, and then when with Adeline, when I took that medication, I forgot, like, so much. So I was like, I'm gonna screenshot right now and see, like, what time I took the medication. So I took the medication around 6 o'clock. It was just an IV. It relaxed me, and it, took my mind off of the pains for a bit. So then eventually so I took the medication at 6:17. By 8 o'clock, I was ready to push. I was literally ready to push. And it was just, they were like, are you not ready to push yet? I was like, no. Are you not ready to push? No. What about now? I was like, I think I need to start pushing. So then they ended up saying, like, okay, can you wait? I was like, yeah, I guess I could. So then they ended up, like, asking, like, how do you want to push? Like, do you want to put your feet on the side? Like, you should hold on to yourself. I don't know. I was just doing, like, the most, like, natural thing that came to me. I ended up, like, putting my feet on the little stools that they put for you and stuff. And the doctor, from what I remember, the doctor was in front of me, and then she was like, okay, so she was like, you can start pushing. You need to hold your breath for longer. You need to push for longer. And then they would start counting, and I wouldn't make it to, like, 10. And then I was like, I can't. Like, I don't want to. I was like, I can't. Like, for some reason, I was just, like, so tired. I didn't want to push. This is only, like, my first or second push. And I was like, I don't want to anymore. It was funny. And then, like, literally out of nowhere, like, my mindset changed, and I was like, I need to get this baby out. Like, let's just freaking do this. And I don't know, it was weirdly painful, but it wasn't traumatic like the first time. I feel like the first time it was just I mean, I've never done it before. It was a first time that my body was going to open up like that. So I think it was easier with Theo because, like my family has said, like, not a lot of time passed. So my body is not, like, like stiff or hard. I don't know how to explain it. Anyway, I ended up, like, pushing, like, 3 or 4 times, from what I remember. And I only say that because, I don't know, that drug does stuff to people. And then, at one point I was like, can I just get some more, medication? they're like, no, it's too late right now. And so I was like, okay, fine. So then he ends up coming out. They cut his cord. Nobody was there with me. It was just me and Theo. And then, like, I swear, I could have sworn I saw, like, 8 other people inside of that room. I don't know if that's normal or what. But I remember looking up. And I don't know if it was, like, the first time that the nurse was inside a delivery room or something. But I remember just looking up to her and her having, like, the most, like, insane face ever. It was kind of like, holy moly, like, what did I just walk into? But I mean, I wasn't embarrassed or anything. I was just like, you know, I don't care. Like, I just don't care what people think, to be honest. What else? I mean, they asked me to push out my placenta. And I remember I was like, I think I asked, is he okay? Because I did ask. I was like, is he okay? Because I didn't hear him cry. And then she said, oh, I'm trying to remember what she said. I'm pretty sure she said, yeah, he's fine. And then she said, oh, okay, just, like, sit back. And then they put more medication. In. She's like, you have a tear, I'm going to stitch you up. And that's when they gave me the medication. They ended up stitching me up. It kind of hurt a little bit when she inserted the needle. I guess that's what they use. But besides that, I was just, like, thanking everybody. I was just like, thank you, like, thank you for helping me, thank you, like, that's all I remember, just, like, thanking people. And I really, like, both times that I've been in the hospital, like, delivering children, I seriously have had, like, I've been so grateful for the nurses. They're just so genuinely sweet. Like, it's just a lovely experience. I had like around, like, 5 nurses or so come in and out, like, changing shifts and stuff, and, like, other people, like the lactation nurse, like, stuff like that, coming in and out, like, being very sweet, very nice, very understanding. I remember the first nurse, I just remember her saying Lovey a lot. She's like, are you okay, Lovey? Like, stuff like that. It was so nice, so sweet. She helped me, like, clean myself. She helped me with the baby. Like, I don't know. Everybody was just, like, so nice. I really appreciated every single nurse and doctor and anybody who came in. It was just a different experience this time. Nothing I would have expected, honestly. He is fine. He was born healthy. He had a minor issue with my amniotic fluid that ended up going into his ear, so he did not pass his hearing test the first day. So we have to go back to the hospital to go get that checked out again to make sure that it was just the amniotic fluid and not a hearing issue that he might have developed. Okay. Are you okay? Sometimes they get like boogers or other things in their mouth and in their noses that stops them from breathing correctly. So I'm just going to take out anything he might have because I just felt like he was choking a little. So yeah, now I'm going to change his pamper. And excuse me if my story times, oh my gosh, it went through. Excuse me if my story times just don't add up. Sometimes I just speak freely. and I'm not really speaking to anybody, so I just come up with conversation that I think somebody would ask me, or something. I come up with conversation that I think somebody talking to me would want to know. And my mind is always like all over the place, and it always has been. So I might come off as not making any sense. So far, he's doing good with sleeping. Adeline has been acting a little different, obviously, because the attention is not all on her anymore. But she hasn't been bad, you know? She hasn't been like a bad girl. She's just learning how to cope with her emotions of not being the only child anymore. And she tries to play with him, which is sweet of her, but she does not know her own strength, and she doesn't know that Theo's really fragile. That is going to be the end of today's video. Thank you guys for watching. Bye.